We begin tonight with breaking news as 2 people are dead, 1 critically wounded after a chemical reaction. It happened at a plant in Kanawha County just after 9:30 this morning. Officials say crews are in the process of shutting down operations and cleaning out equipment at catalyst refineries.
We can confirm the Route 25 is back open after being shut down for most of the day. That's when a chemical reaction involving nitric acid released hydrogen sulfide gas, according to officials. Now the plant is just off First Avenue South and the Institute exit.
We have live team coverage for you tonight. We want to begin with 13 News reporter Sarah Davis. Sarah, you were on the scene there moments after the leak was reported. They even told you had to move back because that odor was still in the air.
Yeah, Amanda, Merrily, that's exactly right. When we first got on the scene just before 10 a.m. this morning, we were about a mile away from the plant, and they told us that we actually needed to evacuate and get farther back because of that shelter-in-place order that's since been lifted. And we spent most of our day beside West Virginia State University, who also had a shelter in place. But I can tell you now at 6 o'clock that, like you guys mentioned, the road is back open. I'm step out of frame, so you can see that. There's some traffic moving forward, and we have seen some emergency vehicles coming in and out in the past couple of hours down where the scene is happening, just down the road there. But I can tell you that when we first got here, the odor was just very pungent and very strong. We're not really smelling that much anymore, and we're also not really hearing any sirens. There were some emergency area sirens going off when we first got here. It's been pretty quiet for the past couple of hours, but like I said, we did spend most of the day around West Virginia State University, and we talked to the president, Eric Cage, and he basically was just saying how thankful he is that so many people stepped in to make sure the community stayed safe. Take a listen.
I want to say thank you. I want to say thank you to all of the West Virginia State community for really coming together to get through this moment of tragedy. But I also want to thank all the members of our community, whether it be our emergency response, our state leaders, for really reaching out to make sure that we were okay here at West Virginia State University. It really does speak to the spirit of collegiality and the spirit of community that exists here in West Virginia.
And as we said, this shelter in place has been lifted for both the general area around Nitro Institute and at West Virginia State University, but crews are still urging people that's traveling through Route 25 or anywhere around this area really just to be careful and take it slow and be mindful that people are out still responding to this. Amanda, Merrily.
All right, Sarah, thanks so much. And now to the impact this is having. We know that some individuals are being treated. 13 News reporter Savannah Young joins us now from CAMC Memorial Hospital.
And Savannah, you've seen a lot today. They had that tent outside ready to do the decontamination process and get people treated as quickly as possible, also while keeping the employees safe as well.
That's right, Amanda. I'm here at CAMC Memorial Hospital in Kanawha City. We've been here all day just watching this scene. Earlier today, the parking lot was a lot more crowded than it is now. There was a yellow tent in this parking lot that had doctors and nurses in protective gear helping these patients who were exposed to the chemical. And they say they helped around 12 patients today, with 1 patient in critical condition. We don't know the condition of the others as of yet, but that is what I'm looking for answers on as we speak. That's what we know for now. It's definitely slowed down. It is not as chaotic. So things are looking a bit slower, calmer, and we're praying for all those families affected tonight. In Kanawha City, I'm Savannah Young for 13 News.
Okay, thanks, Savannah. From one hospital to another, we're going to go to WVU Medicine Thomas Hospital in South Charleston. That's where people are also being treated.
All right, Delaney Wells joins us now. Delaney, what can you tell us tonight?
Well, Amanda and Merrily, when I was first here this afternoon, it was busy. It was hectic. There were ambulances all up and down the street. But if you look behind me, there is a yellow decontamination tent. And just a few minutes ago, it was in use. A man went in and water was running down the street. And earlier I talked to Dr. Tom Takubo, who says there had been 7 patients treated at Thomas, 4 arrived in EMS, 3 had been walk-ins. He says according to what the DEP told him, if a patient is asymptomatic, they need to be seen for 6 hours. But if they have pre-existing lung conditions, they need care for at least 24 hours. And when I talked to him around 2:15 this afternoon, he said no patients had been in critical condition, but he is prepared for the number of patients to increase throughout the day.
As of right now, we've not had anything critical here, and so hopefully nobody does turn critical. What they are telling us, though, that some of this delayed exposure can get worse quickly, which is why we want to bring them in and observe them to make sure that doesn't happen.
He says patients have been coming in and experiencing skin irritation and wheezing. He says they're treating patients with breathing treatments and steroids, and he says delayed exposure to this chemical could worsen. So we will keep you updated with the latest information. Live in South Charleston, Delaney Wells, 13 News.
All right, Delaney, thank you so much. Governor Patrick Morrisey has joined the team at Metro 911 for a news conference.
All right. In the meantime, I know we're waiting for him to take to the podium. Perhaps we could continue showing you guys some footage. Oh, we just got word that he is stepping up to the podium right now. Let's listen in.
Commissioner Salango was here a little bit earlier. I thank him for his work, and for Lance Wheeler, and for Natalie Tennant, and for C.W. Sigmund. The emergency management teams on the local level are doing a lot of great things. I thank everyone on the healthcare side, people who are doing a lot of terrific work to help with the evaluations. And of course, our state-based team, which includes our Homeland Security team, emergency management, includes our DEP, and our Department of Public Health. To the families we lost today, the families of those we lost today, our hearts are with you, and our state grieves for you. We stand ready to support you in every way possible. I also want to pray for all of those who are still impacted. We know that there have been reports of another individual in serious condition. We want to make sure that our prayers go out to that individual and to everyone who had checked in today and as a precaution to try to make sure that they were going to be healthy. Many people have been working very hard all day. I think that some of the folks, though, have really engaged in extraordinary efforts. It's my understanding a lot of the employees of the company had stepped up to do what they can to provide assistance to their fellow employees. We know that the first responders, they always run to the fire. They put themselves in harm's way, and we know that a number of those individuals had checked in to the health facility to evaluate for health impact. We're very grateful to these brave men and women and what they do. And they're in our prayers, and we're monitoring the recovery of those transported to our local hospitals. Right now, the Kanawha County Emergency Management Team is the lead agency on the incident. The state's role is to provide the support that they need. I've said whatever they need, they're going to get a phone call back and a very likely yes in a very short period of time. Right now, the state is providing some backup and technical assistance, technical, logistical, public health support to ensure Kanawha County has everything it needs. Our Emergency Management Division's liaison remains stationed at the Metro 911 Command Center to bridge any gaps, and we've been in contact with the Kanawha County schools to ensure the safety of our students. We know that we are in that process with our medical examiners. We're going to not be able to speak to much of that right now, but at the end of the process, after autopsies are performed on the bodies, we'll be in a better position to comment and talk at greater depth about everything that happened here today. We have the West Virginia Department of Health that is actively monitoring for public health effects. That's critical. I want to thank how quickly they swung into action as well. And we know that the Department of Health's Office of Emergency Medical Services worked very closely with the Kanawha County Emergency Management Team and their command center to ensure that they had every resource available for medical response. We know that the Center of Threat Preparedness has been in constant contact with our area hospitals, and they're also working to ensure that they have the resources that they need. At the request of Kanawha County, the state's Department of Environmental Protection came in, and we're assisting with the safe disposal of waste materials generated during decontamination. DEP is coordinated with the U.S. EPA, on-scene coordinators, and many others to try to help get to the bottom of this and ensure that the cleanup is handled correctly. Beyond these actions, we know that West Virginia Fusion Center and Emergency Management Division, they are fully engaged. I want to say to the people of Kanawha County, your local responders and everyone here, they're doing an incredible job under very difficult circumstances. The state of West Virginia and our team is standing up with them, providing every resource and every piece of expertise available. I know that there'll be a lot of questions from the public, and we may not be able to answer every question tonight, but we want to come before you because it's critical to let you know what's happening on the ground. A couple really important points to emphasize. Earlier in the day, as out of an abundance of caution, a shelter-in-place directive was put in order. Roads were closed. Initially, there were multiple roads closed, and just 25 was opened, I think, at 4:37 today. Part of the reason for that is there is very high confidence. I want to emphasize to the citizens of this area and in Kanawha County that based upon all the information that we have available right now, we don't believe there have been compromises to the air quality or to the water supply, that's been unaffected by this. That's positive. And once again, that's why the shelter in place was lifted and the roads were open. So I want to assure people that people have been on top of this. They're trying to address this situation. We may not have all the answers to the questions tonight, but as we get information, we will be providing that to you, and we'll try to move very fast as this process will undoubtedly engage many different state and federal agencies. We know that OSHA is involved. We know that the Chemical Safety Board gets involved in cases like this, the US EPA. So as we're all coordinating with all of these groups, we're happy to pass along information as we learn it. So that's what we know right now. I'm very grateful for the team that's been working so hard here. They're doing incredible work. And now I want to give the two commissioners an opportunity to say a few words and update folks about what's happening from a Kanawha County perspective. We'll start with you, Commissioner Wheeler.
First off, thank you, Governor, and thank you for being here. We received a phone call very earlier today when this was all going on from the governor's office, and they said that the Governor, Patrick Morrisey, wanted to be here to get the updates, work with us, and provide any assistance, which he did. So we're very grateful for that and appreciate everything that you and your office has done for us. At this time, since our 2 o'clock, we have lifted all of the shelter-in-places here in Kanawha County. We have done testing of the air qualities in all the areas, including St. Albans, Nitro, Dunbar, Institute, and looking at the weather and patterns, and have found that there is no indication of the chemicals in the air affecting the area or the people there as well. And since that time, the DEP was able to arrive on scene, help clean up the site, and we were able to open up Route 25 so that people could be able to drive through there. This was a collaborated effort from everybody, from the state level, county level, to the local level, and all their officials. And I want to make sure that we take this time to thank everybody, including our first responders, our fire, police, EMS, telecommunicators, emergency management. Everybody acted quickly in response as soon as possible, working together to ensure that we made sure that we cleaned up the containment. We made sure that we knew where it was and who was affected and got them the help that they need, and made sure that they were safe, all when seconds matter. And a lot of that is also due to our hospital systems, CEMC and W. Thomas, who we were working with and communicating very early on from the very beginning, ensuring that we had hazmat opportunities for those who needed the decontainment of the individuals at the plant site, and also making sure that people who were having any symptoms were able to be taken care of in an appropriate fashion. So personally, from the Kanawha County Commission and my office, I want to thank the health systems who worked with us and made sure that we were taking care of those affected as quickly as possible. And so at this time, I believe the Kanawha County Commission, along with our emergency management, Metro 911, and all of our first responders, we do feel like the public is safe. There is an active investigation going on with the state agencies, and we are cooperating to ensure that we are transparent and get the facts out as quickly as possible. As you have seen with our 2 o'clock press conference, and now here with the governor and his staff and agencies. So on that, thank you all so much for this collaborative effort working together. I believe we've been able to offer transparency for the citizens of Kanawha County and those in that area, and we will continue as more updates come in to get that transparency and facts out to you as soon as possible. But on that, I would like to ask Commissioner Tennant to come up and make a couple remarks as well. Thank you all.
Thank you, Commissioner, and thank you, Governor, for being here, for offering the support that you have, and for your cabinet members and all the folks who are here, and to our emergency services and to the hospitals, Thomas, CAMC, Vandalia. It's been quite a day, and quite a day for the families who are still worried about their loved ones, who went to work today and expected to come home safely. And we think about them, and we think about what those who have tried to help them do. I take from this today also this opportunity to focus on our EMS, to focus on our first responders, because, you know, while I wasn't on the scene here, I've been here all day long and had the opportunity to see how everyone is working. And you're right, Commissioner, the cooperation among state, local, and federal as they have been coming in and will be coming in. But I just want folks to know what it means to be a first responder. We say it all the time that, oh, they're the first responders, they're the best responders. Well, in this situation, when they arrived and Kanawha County ambulances arrived, those folks jumped out of those vehicles and they went straight to help and try to save lives. And yes, indeed, it did put themselves in danger and in health consequences when we saw 7 of them go to the hospital. And I am hopeful that they are recovering well. They handled contaminated clothing and helped with victims who had been exposed to contamination. And so that's what I think of when I think of this cooperation, that yes, our first responders are going to be there, our folks who come from Kanawha County Ambulance Authority. I also want folks to know about, when we talk about collaboration, public transportation was so important in this, and KRT played a vital role as well, not just having ambulances who were taking victims to the hospital, but also KRT putting folks in buses and getting them to the medical needs that they needed. So this was an opportunity to see this expected type of cooperation, but the uniqueness in it as well. And you will continue to see this from Kanawha County, from the state, from our partners, whether it's just in Kanawha County or in other areas. But this is the kind of cooperation that you will see and that the public should expect, and we will continue to provide that to you. So again, thank you all for being here, and please send out prayers to those who've lost loved ones and those who are still fighting for their lives.
Thank you, Commissioners. I want to emphasize that we really need prayers tonight coming out of West Virginia for the individuals who lost their lives today, and for the individual we know to be in serious condition, and for everyone who was affected by today's incident. We have a lot of people to thank, and I think we're fortunate to be in a place where we're collaborating, and we're going to do everything we can to help the people of Kanawha County and across our state. So with that, I'd be happy to open it up to any questions from the media.
Hi, Charlie Roth, WSAZ. What can you tell us, any updates on the conditions?
So I think that at the 2 o'clock press conference, they talked about the individual that was in serious condition. We don't have an update in terms of how many other people may still be in the hospital. We do believe over 30 had at least checked in. Many, it could be as a precautionary matter. But as we get additional details in terms of the status, we're happy to share that with you. Obviously, a lot of this is personal and they're medical confidentiality, so we want to be sensitive to that. But we know about the 2 who had passed away and the individual in serious condition beyond that, we'll wait as we get more information to share to the public. Next question. Yeah, well, we've been doing a couple things already. First, I know through our DEP, we've been monitoring to ensure that the air has not been contaminated, and there's similar efforts going on. We know, fortunately, that any water intake is pretty far away, but the DEP has really been very proactive, trying to ensure that the air is unaffected by what's going on, and that process will continue over the course of the upcoming days. So our DEP got on top of it very, very quickly, and we're pleased to work with our emergency management division and the other state agencies involved. So we're going to continue that effort because we want to make sure that what we just told you in terms of the air and the water remains true. That's important, and we have to monitor that. You know, one of the questions I asked during our briefing earlier is there any other circumstance where we've seen these various chemicals that have come together? And I'm not aware of that right now, but you always want to make sure you know what's happening in the short term and the longer term, and we, of course, want to monitor both. I have not had communication with them. I'm not sure if others on the team. I think DEP has been working on site and working with our contractor for cleanup. So there's probably been some coordination there. But obviously there's going to be an investigation of everything that happened today. And so we'll be working and collaborating with everyone. Yeah.
Obviously, you know, thinking of the bigger picture, there are several chemical facilities across the state.
Well, I think first we have to do a analysis of everything that's happened. So it's a little premature on day one to know everything that occurred. We know that there was a violent reaction when very chemicals met that was not supposed to occur. But beyond that, there's still a lot that needs to be determined through the investigative process. So I think we're always going to look to take steps to make sure that our people are protected, our air is clean, and our water remains in good condition. But we just don't know enough yet, and we want to learn a little bit more. But I can tell you this, we have a team of people on the state level, whether it's through our Department of Health, our DEP, our emergency management folks, and at the local level, who run to the fire, who immediately react whenever an issue like this arises. I think that matters tremendously. The actions of the first responders and the employees likely saved lives today. Why? Because they put themselves at risk to try to help their fellow man. That matters. But in terms of broader policy relating to chemical issues, this is not something that people would have foreseen. So beyond that, I really don't have any other comments. Any other questions from media? Charlie, you're pushing your luck, buddy.
No one else is going to ask a question. I'll keep asking you.
Go ahead.
I think several people have talked about
Sure.
certainly for you, but for everyone.
Yeah,
at
of
home.
course.
Is there anything else you can say to ensure driving down Route 25 or anyone in the area?
Well, I will tell you that we have been monitoring all day, and we're going to continue to monitor, because if we see anything that's problematic, we're going to immediately alert the public. But our DEP has been working on the ground right away. We know that our Department of Health has deployed people. So we're going to try to get all the information and be transparent about it to folks so people know. But that's why the roads got opened. That's why the shelter in place was lifted, because there was that confidence level. And so if something ever changes, we'll let people know. But we feel good about that today, and we'll keep in close touch. I think one thing that people know about me is that I'm going to go before the cameras and I'm going to tell you the way it is, and we're going to continue to do that as long as it takes right here. All right. I want to thank everyone for coming. I want to thank everyone who's up here today.
Right.
A wonderful group of people.
We've been listening in live
that
to
are
this
coming.
press conference here. That's Governor Patrick Morrisey along with county commissioners. And the big takeaways, some nuggets to pass along too, just to recap, is at least for right now, the state is providing backup and assistance just to ensure that all of that contaminated material is disposed of properly. And another big takeaway too that we heard from one of the commissioners is that the air quality and the water quality have not been impacted by this.
What we do not know this hour is the status of the man who's fighting for his life. We'll work to get that information for you. We're back in just a minute.